We're continuing our Heart Health at 4 series today. February is American Heart Month, and so every Tuesday this month at 4 o'clock we're discussing how to keep a healthy heart. And today we're talking about heart disease specifically in women. So joining me now is Dr. Shauna Nesbitt. She's a cardiologist at Parkland Health. Thank you so much for joining us this afternoon, Doctor.
Great, thank you, Alicia.
So let's start off with the stress test, the cardiac stress test. What exactly is this test, and how exactly does it work?
So the stress test is really our way of assessing how robust is your heart. That is, how much can your heart really take? And there are a couple different ways we can do that. We can do that with an exercise stress test, which means you get on a treadmill and you walk, and we raise the level of the treadmill and test how fast your heart beats. We test what the transmission of the electrical current through the heart, the EKG, if you will, and we look at a number of different places in that EKG that really indicate whether or not your heart is getting enough blood flow.
Enough blood flow.
Right.
Okay. So let's figure out who even needs to come in for a stress test. Are you showing certain symptoms, or is there a certain age where you need to go in and say, hey doctor, I think I need this? How do you figure out if you need this?
Yeah. So one of the things is that we're looking at people who present with symptoms.
Okay.
So if you were to come in and say, I've got chest pain, I've got shortness of breath, I'm having pain when I do my normal activity that I didn't have before, would be a sign that you may have a new level of cardiac blood vessel obstruction that might be limiting the muscle from beating properly. And the stress test really shows us that. Because there are a couple different ways you can look at heart function. You can look at the anatomy and you can look at the function. And the stress test really is more about function, whereas having a cardiac catheterization is more about anatomy.
Okay, and so you mentioned another test, that cardiac catheterization. I want to put up a list of other follow-up exams or screenings you would get depending on what the results of the stress test show. So let's talk about some of those. Right,
so monitoring your heart rate, excellent way to assess how fit your heart really is. And so people who are incredibly fit, who work out a lot and run and ride bikes, their heart rate tends to be quite low. Blood pressure, very important. Hypertension is one of the leading risk factors for heart disease, as well as strokes and other cardiovascular problems. So having your blood pressure assessed on a regular basis really is an important way to protect your heart. And the new guidelines suggest that our blood pressure should be less than 130/80, ideally.
And when we're talking about women specifically, can you explain why it's so important for women to make sure they have a handle on this and they're monitoring their numbers?
Importantly, women die from heart disease much more commonly than they die from breast cancer and a lot of the other diseases that truly we talk a lot about, but the #1 killer for women is heart disease. 1 in 3 women die from heart disease compared to 1 in 31 women die from cancer. And so that's not to belittle cancer, but it is to say you're likely to have a heart problem before you're likely to have cancer.
Well, those numbers certainly are sobering, and so as we talk about the symptoms that you mentioned earlier, if any of that sounds familiar to you, then it's at least worth having a conversation with your doctor to figure out if you need this. Dr. Nesbitt, thank you so much for joining us this afternoon.
You're very
really
welcome.
Appreciate it.